Freedom. Freedom is never more than one generation away from extinction. We did not pass it on to our children in their bloodstream. It must be fought for, protected, and handed down to them to do the same. Or one day, we will spend our sunset years telling our children and our children's children what it was once like to live in the United States, where men were free. Ladies and gentlemen, it may seem strange to start out a presentation on medical with a quote from Ronald Reagan about freedom. But just think of all the freedoms you will relinquish when you turn full control of your medical care over to a government bureaucrat. Medical realities. Good afternoon, ladies and gentlemen. My name is Tom Valancourt, and I have been researching medical since the passage of Obamacare in 2010. I have talked to as many professionals in medical community as I can in both the United States and Canada. I have enough information to give a 2-week seminar, which I'm sure will bore you all to tears. What follows is a presentation highlighting the main points about medical realities. Reality number 1, everyone must have health care. Reality number 2, someone must pay for it. Reality number 3, too many Americans equate health insurance with health care. Health insurance is not health care. Your insurance company may or may not pay for what your doctor recommends. In fact, there's a lot of people who simply say my insurance company is actually my primary care physician. Too many Americans are not aware of how the medical community is reacting to Obamacare and its aftermath. There are not enough doctors. It's as simple as that. There are not enough doctors.
All doctors to the ER.
The situation is getting worse, not better. The last time you went for a checkup, did you see a doctor? Did you see a nurse practitioner? Did you see a physician's assistant? Or none of the above? Every person has their own horror story. Long waits for an appointment.
If you need help, then dial your operator.
Doctor no longer in the network.
Paging Dr. White. Dr. White, call your office.
Copays, unaffordable. Doctor does not accept new patients on Medicare.
The number you have called is no longer in service.
The truth is, ladies and gentlemen, we are at a crossroads. We are either going to go 100% socialized medicine or return to personal responsibility for your own medical care.
Yeah.
I do not see any way you can marry the two. Where are we now? One step away from socialized medicine. The Democrats are pushing their universal health care agenda.
The truth shall set you free!
The lead vehicle is Vermont Senator Bernie Sanders' Senate Bill 1129, billed as Medicare for All. And here it is, ladies and gentlemen, Medicare for all. But in reality, it's Medicare for no one. This bill would create a government monopoly on health care, and that's the key word, ladies and gentlemen, monopoly. The government would control where you go to the doctor, where you go to the hospital, where you get your dentist, where you get your optometrist. Every single bit of medical care would be controlled by the government, and you would have to go through the bureaucracy to get medical care. It would outlaw all private health insurance, including American-based job coverage, where most of us get our health insurance. It would impose restrictions on private medical practice. Think about this, ladies and gentlemen. If you want to pay a doctor to get medical care, both you and your doctor can go to jail because you didn't go through the government bureaucracy. Think about that for a minute. You would simply have no choices.
Uh-oh.
How did we get to this point? The boiling frog story is generally offered as a metaphor, cautioning people to be aware of ever gradual change, lest they suffer eventual undesirable consequences. The best way to boil a frog is to put it in cold water and then slowly but surely turn up the heat. Slowly but surely, the government has taken over medical in the United States, starting with Medicare, and it made a giant leap with Obamacare. In 2010, Obamacare became the law of the land. And make no mistake, ladies and gentlemen, Obamacare is still the law of the land. The only thing that has changed is the tax penalty has been removed. This is Obamacare, Public Law 111148. It's a 4-inch binder. It's filled front to back in pages, printed on both sides in number 10 font. This thing is a monster. This is the organization chart for Obamacare. Can you imagine what that is going to look like when the government controls every facet of medicine? Public Law 111148 contains the wording, "The Secretary shall." This appears 1,444 times. So you would think logically that Kathleen Sebelius, who was in front of the Senate and got confirmed as Secretary of HSS, would have had a lot to do with writing the law. Well, now we know that Mr. Gruber wrote the law. And Mr. Gruber kind of thinks Americans are too stupid for the truth. So I have a question. Have you ever seen Mr. Gruber's name on a ballot? Have you seen Mr. Gruber in front of the Senate to be confirmed? No. Mr. Gruber reported to one man and one man only, Barack Obama. Obamacare has simply made the average American a serf. For those of you unfamiliar with medieval history, a serf or peasant are the ones that did all the work, and the nobility took the benefit from their work. Today we call the nobility the ruling class or the elites. And to have a little fun with it, we got Mitt Romney, Nancy Pelosi, and AOC representing the ruling class. But the reality is, ladies and gentlemen, Obamacare has taken away a lot of our freedoms, a lot, starting with religious freedom. Through a rulemaking process, American citizens are being forced to pay for abortion. The Socialist Party, which is very much in charge right now, is trying to remove the Hyde Amendment, which will force American citizens to pay for abortions in other countries. So we're not only going to pay for abortions here, we're going to pay for abortions in other countries. But wait a minute. We have a U.S. Constitution. And Amendment 1 clearly states, Congress shall make no law respecting the establishment of a religion or prohibiting the free exercise thereof. Many Americans hold strong religious beliefs against abortion. And by being forced to pay for abortion with their tax dollars, they feel they are being prohibited the free exercise thereof. Thomas Jefferson, to compel a man to furnish funds for the propagation of ideas he disbelieves or abhors is sinful and tyrannical. Many Americans think we have a right to privacy. As a matter of fact, it was the right to privacy that the Supreme Court used to pass Roe versus Wade and legalize abortion. Well, Obamacare takes away that right to privacy. Obamacare gives centralized computer records, the government's medical records on everyone. Everyone's government medical records will be in a database. The Wall Street Journal reports that tech firms will get identifiable hospital data. Identifiable, which means your name is on it. Hospitals have granted Microsoft Corporation, IBM, and Amazon the ability to access identifiable patient information under deals to crunch millions of health records. Let's think about this for a minute, ladies and gentlemen. All of your financial records are in a database at the IRS. Now, all of your medical records are going to be in a database in Washington, D.C. And these two databases can be accessed by any government clerk anytime they want to in order to make Obamacare work. And that is directly in the law. The law says they can access these databases for other reasons. Right to privacy. Obamacare's two biggest lie. Lie number one, if you like your doctor, you can keep your doctor. If you like your health plan, you can keep your health plan. Boy, that was a whopper. Lie number two, quote from the official Democratic Party talking points on government-controlled health care. And here they are, ladies and gentlemen, and the cover letter is signed by Nancy Pelosi. Question. I have heard that under the health care law, there is a panel that can order my doctor not to give me certain procedures, therapy, or care. Bureaucrats will decide whether I live or die. The official Democrat answer, there is no such panel. This is a blatant falsehood. The Affordable Care Act, Section 6301, authorizes the establishment of a patient-centered outcomes research institute. And here it is, ladies and gentlemen, Section 6301. This section contains wording such as subpopulation, clinical effectiveness, kind of gets a general idea. Now this lacks the panache of the English system, which is NICE, National Institute for Health and Care Excellence, whose motto is improving health and social care through evidence-based guidance. But make no mistake, ladies and gentlemen, these two panels have the exact same job: to determine quality adjusted value of life. Since we are one step away from socialized medicine, and the Democrat Socialist Party are making socialized medicine a key part of their agenda, therefore it is important to ask the question, who is in control? That's what should be keeping you awake at night. Who is in control? Well, during the COVID virus, that showed us who really controlled our lives. Governors of certain states assumed dictatorial powers. The government assumed complete control over every aspect of our lives, from wearing masks to where we could shop. The interesting thing is that as the pandemic decreased, these governors did not give up their dictatorial powers. They simply loved it too much. George Orwell's 1984 has fiction become reality. Let's take a look at what has happened in other countries that have socialized medicine. England's National Health Service decided Charlie Gard, a 10-month-old, should die. Decided Alfie Evans, a 23-month-old, should die. Legal challenges by the parents failed. In effect, the courts ruled the parents had no rights. These children were property of the state. There are more examples of abuses going on in countries that have socialized medicine, but this example makes the point emphatically. Abortion and euthanasia are necessary steps by the ruling class in order to control who lives, from who is born to when the elderly have a duty to die. Do you want a bureaucrat, any bureaucrat, making life and death decisions for you? It can't happen here. I hear that all the time. It can't happen here. Article by Marilyn M. Singleton, MD, President of the American Association of Physicians and Surgeons. Free medical care, a deal with the devil. With regard to medical care, all medical necessary. Who's going to determine what is medically necessary? Your doctor or a bureaucrat? With regard to medical care, all medically necessary health services with no premiums, deductibles, or copays from the cradle to the grave. Sounds pretty good. Sold. Frankly, given the direction of so-called reproductive health is going, you may never make it to the cradle. And political cartoonists have a way of making points. And with the current laser focus on hospice for all, you may get to your grave a little faster. Sometimes I just want to shout, pay attention to the growing number of minute clinics and pharmacies and superstores. Walmart for medical? Oh, and by the way, where did you get your COVID vaccine? At a doctor's office, clinic, hospital, or your local pharmacy? To all the states that have removed all restrictions on abortion, New Mexico recently removed all restrictions on abortion and legalized euthanasia. So I guess the present legislator and governor is making death the culture of the state, and New Mexico the abortion capital of the Southwest. Just exactly what is socialized medicine? Well, here's a comical look at it. You can see where the doctor has a stethoscope. But the best description I've ever read on socialized medicine was a one-page article by Dr. Jeffrey Singer. And I want to read you just the middle paragraph. In other words, we are about to experience the two-tiered system that already exists in most parts of the world that provide universal coverage. Those who have the financial means will still be able to get prompt, courteous, personalized, state-of-the-art health care from providers who consider themselves professionals. But the majority can expect long lines, mediocre and impersonal care from shift-working providers, subtle but definite rationing, and slowly deteriorating outcomes. That, ladies and gentlemen, is something I would never like to see happen in this country. But unfortunately, it's already started. Watch out for the public option or the Medicaid buy-in. It is simply a Trojan horse to install socialized medicine. Now, most Americans get their health insurance through the company they work for. And these companies spend a lot of time and a lot of money on medical. So a simple answer for the company: only provide the public option and save all that time and all that money, because now medical is the government's problem. And ladies and gentlemen, no private health insurance company can compete with taxpayer-funded government health care. The federal government is the single payer. Government-run health care takes medical decisions away from the patients. The faceless single payer calculates the value of your life based on benefits to society. The single payer determines what treatments are necessary and appropriate for you. The bureaucrat, not the doctor. Can you say quality adjusted value of life? Your medical care will be provided by younger, less experienced physicians, non-physicians, possibly no one. In what order is the money distributed? Some money will trickle down to those who help patients, but 40% or more may be siphoned off en route. The single payer pays administrators, rule makers, compliance officers, auditors first. Your doctor second. Someone must pay for it, so it's got to be the taxpayer. Well, right now we're $30 trillion in debt, and all the experts agree that socialized medicine will cost $32.6 trillion over 10 years. That's over and above what we spend now. Cost control. Cost control will be done in this country the same way it is done in other countries that have the single-payer system. The National Health Service sharply restricts hip and knee replacements, cataract surgery, arthritis, diabetes. Kind of get the age group where they're restricting things? Do any of you know anybody in their 80s that can't get a hip replacement? Interesting question. Everyone must get health care, but the single payer does not guarantee health care. However, here in America, because of the free enterprise system, the best health care in the world can be found. Isn't it time we listen to what doctors are saying? After all, doctors are essential to health care. And I want to give you just one of the many examples of interviews I've had with doctors. Dr. Patrick Wagner expressed deep feelings in his article, Laid Bare. To experience the destruction of a very, very intimate and loving friendship that between myself and my patients is heartbreaking beyond description. The article goes on in depth, but you get the idea. Solutions. I'm kind of big on solutions. We've stated the problems. Let's see if we can have some solutions. The American people taking personal responsibility for their own health care. Medicine that is free of government intrusion and protects the sacred bond between doctor and patient. Eliminate third-party payers. Now, ladies and gentlemen, this is very important. You have to get the third-party payers out of it. You've got to get the government out of it. You've got to get your company out of it. It's got to be between you and your medical provider and how you want to work it, not some faceless third party. Why is Costco and IKEA so popular? The business model is very simple. Eliminate the overhead and profit of a third party. It goes directly from the manufacturer to the stores. You're saving warehousing costs and distribution costs. Question. When you put gas in your car, you fully expect to pay. When you have a meal in a restaurant, you fully expect to pay. When you go to Costco, you fully expect to pay. So why is it that when you go to a doctor or a hospital, you expect someone else to pay? Why is that? So what, if anything, should the government do? If at all possible, we need our government to adhere to the KISS principle. Keep it simple, stupid.
Yeah.
Good luck with that. Simply put, only 3 things are required. Ladies and gentlemen, I could write the healthcare law on one piece of paper. Number 1, true health saving accounts. Money put into an account for payment of medical expenses. No taxes at all, not even payroll taxes. 2, true catastrophic health insurance. Insurance that covers only major illnesses, cancer, heart attack, stroke, to name a few. And step number 3, all medical expenses are taken off the top of your income. Now let's talk about that just for a minute, ladies and gentlemen. Right now, you have to spend 10% of your adjusted gross income on medical before you can deduct 1 penny. However, let's say you own a Roto-Rooter franchise and you send an employee to the car wash to get that truck washed. Every single penny you spend comes right off the top. Why? Because it's the cost of doing business. Now, most Americans do business with their mind and their bodies. Therefore, any cost of maintaining your health should come right off the top of your income. No taxes at all, just like corporations. The key, the HSA and the catastrophic insurance policy belong to the patient. If the patient changes jobs, the HSA and insurance policy goes with them. Pre-existing conditions are no longer an issue. It's decision time, ladies and gentlemen. It is time to decide whether we want to go to socialized medicine or personal responsibility for your own health care. As a nation, the following question has to be answered. Is it the job of the federal government or government at any level to ensure every American has health insurance. Is that really the job of the government? No solution is possible until that question is answered.
Yes, quite absolutely.
If the answer is yes, be prepared to turn over your decisions on your health care to the same people who run the Post Office, TSA, IRS, DMV. After all, ladies and gentlemen, a bureaucrat is a bureaucrat is a bureaucrat. If the answer is no, be prepared to take personal responsibility for your own health care. In other words, freedom. Free to choose your doctor, your health plan. Ladies and gentlemen, we're all familiar with our founding documents. A simple review of the Declaration of Independence makes it very clear that our rights come from the Creator, not the government. Quote from the Declaration of Independence, that to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed, that whenever any form of government becomes destructive of these ends, it is the right of the people to alter or abolish it. Unquote. After a long and bloody conflict, a constitution was established to secure these rights. Ladies and gentlemen, we're the only country in the world that has these founding documents that have endured for many, many years. Documents that establish and secure our rights. What this means is we have the freedom to live our lives as we see fit, with the least amount of government interference as possible. Government cannot and should not control every aspect of our lives. Government cannot and should not try to guarantee results. Remember, socialized medicine equals all control of your medical care is in the hands of the government. You have no choices. You are, in fact, property of the state. There is a saying as old as the time itself, and is just as true today as it was in medieval times. He who pays the piper calls the tune. So what can I do about it? Stay informed. Get involved. Work for the candidate of your choice. If you want to change the law, you have to change the people who make the law. The American people have voted away their freedoms in exchange for the promise of free medical. It only took 2 generations for what is commonly called the greatest generation.